So today we will study about anemia. What is meant by anemia? What are types of anemia? What are the causes of anemia? And then what are the treatments? So first of all, we will see what is anemia. What is meant by the word anemia? The word anemia means deficiency of hemoglobin. Deficiency of hemoglobin. What is hemoglobin? Hemoglobin is that protein that perform the function of conduction of oxygen. So hemoglobin is deficient in case of anemias. Why it is deficient? It can be deficient due to low hemoglobin formation inside our body or low RBC count, because hemoglobin is present in RBCs, and if there are less RBCs than normal in our body, then we will definitely lead towards the anemia. Anemia means deficiency of hemoglobin. Deficiency of hemoglobin can be due to low hemoglobin level inside the body or low RBC level. Now we will study what are the types of anemia. So there are about 5 types of anemia. The first one is blood loss anemia, second one is aplastic anemia, then hemolytic anemia, megaloblastic anemia, and then sickle cell anemia. We will study each of these types in detail, but in this video we will study about blood loss anemia and aplastic anemia. For hemolytic anemia and megaloblastic and sickle cell, you have to see the part 2 video. So what is blood loss anemia? Blood loss anemia is, as it is meant by the word, blood loss. If there is blood loss, there must be RBCs loss, and if there is RBC loss, there must be hemoglobin loss. So this is a type of anemia which is caused by the blood loss. Now the blood loss can be acute and can be chronic. Acute means that you have a hemorrhage only one time, or blood loss only one time, and chronic means you have continuously blood loss inside your body. So blood loss anemia can be acute, means blood loss can be acute and chronic. We will study anemia in both cases. What will be the type of anemia in acute case and what will be in the case of chronic. Now if we study that there is chronic blood loss, we have an hemorrhage, we have hemorrhage, the body will try to recover it within 3 to 6 weeks. The blood loss which is committed during hemorrhage is usually recovered by the body in 3 to 6 weeks. But now if we have chronic hemorrhage, chronic blood loss, then we know that if we have chronic blood loss, there will be a chronic hemoglobin formation loss. Why hemoglobin formation will be affected? Because there will be less iron. Why there will be less iron? Because loss will be more rapid than the process of formation. So in the case of chronic hemoglobin, there will be loss of iron, and due to loss of iron there will be less hemoglobin formation, and when there will be less hemoglobin formation, there will be anemia. And now we will study the type of RBC formed during blood loss anemia. They will be microcytic. Micro means small in size, means the red blood cell size will be small, and hypochromic means they will be less bright red, less colored, less chroma. Why there will be less chroma? Because there is loss of iron and there is not efficient form of efficient form of hemoglobin inside our RBCs. The hemoglobin is usually 95% inside our RBC, but in case of anemia there will be less percentage. When there will be less percentage, the color of the red blood cells will be less bright. Then, and if they are less bright, they will be considered under the category of hypochromic. Microcytic, small. Why they will be small? They will be small due to less hemoglobin formation, and they will be less colorized, less color due to loss of iron. Loss of iron will lead to hemoglobin formation, affect hemoglobin less formation, and this will consequently lead towards the hyperchromic anemia. Now we studied that how the chronic hemorrhage causes the blood loss anemia. Now we will study what is if there will be acute hemorrhage, then what will be the type of anemia. Then if we have acute hemorrhage, we will have a blood loss. Then there will be normocytic normochromic anemia, means there will be less red blood cells. Why there will be less red blood cells? Because we have lost our a large volume of our blood, which is consequently leads towards the loss of RBCs. There is loss of RBCs, but there is no loss of iron, no less hemoglobin formation. It's normal, and it's too normal, so it will lead to normocytic and normochromic, means the remaining RBCs will be low in number, but they will be having the normal size and normal color. So acute blood loss anemia will lead towards the normocytic and normochromic anemia. So blood loss anemia was this. We studied the case of acute hemorrhage, and then we studied the chronic case. Now the next type is aplastic anemia. Aplastic anemia. It is caused by your bone marrow non-functioning. We know that our hematopoietic stem cells are inside our bone marrow of our ribs, sternum, and hip bone usually. So hematopoietic stem cells will be affected in this case. They will be they will not express themselves, not mature, means that our bone marrow non-functioning leads towards aplastic anemia. It can be due to if you are having some type of chemotherapy and you are taking high doses of radiation, then the bone marrow can be affected in this case. The second type can be the toxins that you are taking, large amount of toxins, insecticides or benzene, etc. type. Radiations and then toxins. And then third form is autoimmune disorder. Autoimmune disorder means auto means self. If your immune function respond to your own antigens, attack your own antigen, your body antigen, then this will be called as autoimmune disorder. For example, in lupus erythematosus. In lupus erythematosus, our immune system work against our bone marrow, our hematopoietic stem cells. Which consequently led towards the aplastic anemia, means our bone marrow is non-functioning. Now, if we are having aplastic anemia, then what kind of RBCs will be formed? And first of all, we will study the fourth cause, that is unknown. Means we can have aplastic anemia due to radiation, due to toxins and autoimmune disorder, and the fourth cause is unknown, which led to, and if the cause is unknown, we usually call it as idiopathic aplastic anemia. Now, what is the type of RBCs formed in aplastic anemia? They will be normocytic and normochromic. Why? Because the bone marrow is affected. Bone marrow is affected, remaining bone marrow is 100% efficient and 100% correct. So it will produce normal RBCs. Means that RBCs will be having the normal color and normal size and normal shape. So this was the aplastic anemia. Now we will move towards the treatment of aplastic anemia. What can be the treatment of aplastic anemia? It can be because we have severe blood loss, means we have severe loss of RBCs that can lead to severe effects. So there will be the immediate treatment can be blood transfusion, which work for compensation of RBCs. And then the final treatment and the permanent treatment can be bone marrow transplant. The immediate treatment for aplastic anemia is blood transfusion. If we are having a severe type of anemia, then we will have to go for blood transfusion. But if we want a permanent treatment of aplastic anemia, then we will be having bone marrow transplant, and this was the aplastic anemia.